Hello friends, in this video we are going to see about growth monitoring in children, the very vital component in the life of pediatric population, and it is important to measure the growth parameters right from the birth to the adolescent category. And we must understand what is growth monitoring first. It is important to monitor the growth of the children. Why? Because we have to differentiate between the normal and abnormal growth patterns of the children, and the first few years are very crucial for the growth and development, and the periodic monitoring helps pick out the problems at an early stage, especially the under 5 population. And it is another important requirement for pediatric health surveillance and is one of the basic activity of under 5 clinics. So to complete this growth monitoring process, we are using some kind of charts. Those charts are called as growth charts. So these charts are nothing but standardized graphs upon which a child's measurements may be plotted. And this information allows a visual mechanism to compare the child's rate of growth over time. You can mark this rate in months as well as in years, and this technique allows an assessment of how child's rate of growth compares to his peer group as well as his own previous rate of growth. So this helps us to identify or understand whether the child is growing appropriate with the age or having some lacunae. And the cumulative measurements over a standardized block of time enhance the precision of such an assessment. So we will come to know, for example, 3 months continuously or 6 months continuously you are having this assessment measurements in your hand. So now you can able to differentiate the growth patterns of the children, whether they are growing or somewhere they got stuck. So this delayed growth and development can be identified, and the corrective measures can be planned in the beginning stage itself. And to complete the process, as I told you, the growth charts which we are using can be divided into two types. One is growth standards, which means the chart which we are using is known as growth standards, and second is the charts based on growth references. Let us see the meaning of growth standards. What is growth standards? The growth chart which we are using, that is defined as under the given optimal nutritional and health condition, how a population of children should grow. So it has some pre-defined values, and we are expecting the children should fall in that category. Then we are using the standard growth chart. Example, the World Health Organization growth charts published in 2006 for children under the age of 5 years are an example of growth standards, because the values are already written over there and we are just monitoring in which category the children are falling. So in a standard WHO percentile chart, there are usually 5 percentiles lying corresponding to 3rd percentile, 15th percentile, 50th percentile, 85th percentile and 97th percentiles. And the second type is growth charts based on growth references. They are descriptive data that define how children in the population are growing under the best possible state of nutrition and health in a given community. So this is something different from the first type, that is growth standards. So the second type represents how children are actually growing. The existing scenario can be assessed by using this growth references rather than how they should be growing. There is no expectation, but the actual situation can be assessed by using this growth references chart. And the example I can say, Indian Academy of Pediatrics have developed growth charts in the year 2015, and which describe how children in India were growing at that point of time. So for the specific point of time, if you want to assess or measure the growth parameters of the children of the particular community, you can use such growth references chart, and that can be assessed to uh, identify the growth parameters of the children. So this is a difference between charts which are having growth standards and growth references. And when we use World Health Organization growth charts which are having some standards which are different from other growth charts, it has been revised also, and it has some standards. What are those standards are? One is WHO standards are based on longitudinally collected data as opposed to cross-sectional data in previous charts. So now this is revised. So they have used longitudinally collected data from many countries, and they have come to the conclusion these charts can be used in any part of the country. So globally accepted technique. And second standard is describe how children should grow as compared to earlier references which simply stated how children are growing. So this criteria they have fixed how children should grow. So the parameters also they have, and they are expecting the children to meet that set criteria, right? Okay, so third standard it is make breastfeeding the biological norm and establish the breastfed infants as the normative growth model. So in another way they are establishing this breastfeeding is a mandatory content or subject that up to 6 months all the children or the infants has to be breastfed unless until there is no medical conditions. And apart from this, another standard it also includes other growth indicators such as the skin fold thickness and body mass index. And we know that these two are useful to define the obesity and overweight of the children. And these are the standard procedures we have when we use World Health Organization growth charts. So it differs from all other growth charts which are available. And hence it is recommended to use the World Health Organization growth charts to measure the growth monitoring or growth related parameters of the children. This is one of the health indices prepared by and proposed by World Health Organization, length for age, especially for the boys. So we have these kind of charts or growth charts available for both genders, boys and girls. It is available, and age is also mentioned. You can see here this is birth to 2 years of age, and you can see the percentile it is mentioned over there. You can see the 5 different color codes here: third percentile, 15th percentile, 50th, 85th, and 97th percentile. So, and on the bottom you can see age, completed months and years it is mentioned. On the left side corner you can see length in centimeter it is mentioned. So this is length for age for the boys. And another component is road to health card. What it is, the weight for age chart is an essential part of the road to health card. And the area between the third and 97th percentile is shaded in. It is important that the infant's weight remains within the shaded area and increases parallel to the percentiles. If the infant's weight keeps within this normal weight for age range, it is following the road to health, which means you can understand the children are growing normally, along which the child should steadily walk. And the normal growth suggests good nutrition, which means you can understand, yes, the nutrition which you are providing, it is the right one you are giving to your children. And monitoring weight gain or loss on the road to health card is one of the most important methods of identifying children at risk of malnutrition. So by using this growth charts, we'll come to know or we'll identify regarding the nutritional status, because nutrition is the most important factor. It helps to have the normal growth parameters in the children, either height or weight, and this can be measured. So this is the best indicator that if you are using this road to health card, you will come to know whether the child is under risk or having proper nutrition or the nutrition status is good. And this is a major part of primary health care, and it is important that each mother understands and takes an interest in the child's road to health card. So it is easy to monitor also. So every mother has to be sensitized how to use this road to health card, and they can monitor even at their home also, or they can visit the health centers to monitor the growth parameters, and they can have an idea. Yes. Let us see some of the importance of growth charts here. So they provide a visual display of the rate of growth of an infant, child, or adolescent. So this age category population can have this growth charts, and they can understand the parameters. It is a visual display, we can say. So infant growth charts document length, weight, and head circumference, and the children and adolescent growth chart document height, weight, and BMI, that's body mass index. Growth charts provide a unique long-term assessment of the overall health of the patient. So continuously 2 years, 3 years, 4 up to 5 years, you can have this cumulative assessment of the children. So that gives some unique measurement or assessment. You'll come to know the changes, the variations which happens in the growth and development of the baby. And growth chart abnormalities would include children either not on the chart, either they are deviated from the normal growth, or an unanticipated acceleration or deceleration of the child rate of growth over time. So we will understand whether they are on the track or deviated from the normal growth patterns, whether it is increased or decreased, developmental delays, growth delays, or any changes, abnormalities can be ruled out. Extremely important method of screening children for malnutrition. So we are using this tool to identify malnutrition in children. And as I mentioned earlier, WHO growth charts are available for boys and girls for various health indices. There are 7 health indices that are health charts available you can measure for the children. One is length for age, that is 0 to 5 years of age, it is available. Height for age, that you can assess from 2 to 5 years for both boys and girls. And third one is weight for age, that from birth to 5 years, and weight for length 0 to 2 years. Weight for height 2 to 5 years you can assess for both boys and girls. Body mass index up to 5 years of age you can do it, and head circumference also from birth to 5 years. So these are the various charts available from World Health Organization to assess the or to monitor the growth patterns of the children. So this is another chart, head circumference for age. This is for the girls, and it is written over there birth to 5 years, and percentage it is mentioned. The 5 percentile grades are mentioned over there, and you can see at the bottom it is age, it is mentioned in here, birth to 1 year, 2 years, 3 years, 4 years, and up to 5 years. On the left hand you can see head circumference, it is in centimeter, it is mentioned. And this is for the boys, head circumference for age and birth to 5 years. Same measurements only, percentage it is mentioned, and age is also mentioned in years, and head circumference in centimeters. Okay, so this is all about growth monitoring in children using growth charts, which is available and recommended by World Health Organization. Hope you all understand this topic. Thank you, and see you again.